Health Matters on Midday. Dr. Richard Ferguson. Dr. Ferguson is an emergency room doctor and president of the Black Physicians of Utah. He tells me while COVID numbers are low in Utah right now because it's still warm, that's likely to change in the next few weeks.
And so people aren't really together yet to really increase spread. But I think we're going to see the bump start to occur as we get into Halloween, and particularly as we see people go home for the first big holiday, and that being Thanksgiving.
All right. So there is so much political division over COVID, but as a physician, do you believe that this is something people should still take seriously?
Yes, I do think someone should take it seriously, particularly those that are from impacted or high-risk groups. And when I say those that are high-risk groups, I'm talking about people that have asthma. I spoke about asthma not long ago here, and actually some people don't realize how many folks with asthma are impacted. The person with asthma is more likely to be that ICU admission, more likely to be that person that's going to go to the ER as opposed to just going to an urgent care and staying home for 5 days. That's going to be the person more likely to get asthma, to be admitted. Someone with a history of cancer, chronic kidney disease, so someone on dialysis, even children that have had bronchiolitis multiple times within the year, they can be at increased risk, and those with liver disease and diabetics. So I don't want us to minimize its risk and how we want to protect people from hospitalization, which is the primary purpose of the vaccine.
So the CDC.
So I do think. Yes,
I'm sorry. Go right ahead. You do. Go ahead.
Yeah. So people should take it seriously, especially if you have someone that falls into one of these high-risk groups that you may be around. So definitely they should be protected. And then to go towards, what the CDC advisory panel, the ACEP, has said, the advisory committee on immunization practices, ACEP, their newest statement that came out almost 2 weeks ago now on shared clinical decision making, rather than saying everyone get the recommendation. And they're doing that because some people may not take it as seriously, and they need to understand what's their risk factors and should they get it or not. And I believe I support that tactic because people should be having shared clinical decision making for many areas of their health, and particularly health conditions, particularly when it comes to chronic management, but definitely for vaccination. But should everyone get it if you don't feel you're at risk or no one in your family's at risk and you're not going to be placing others at risk? Then I could see someone saying, no, I'm not going to get it this year. I totally understand it because it's ubiquitous now in our environment. It will cause a mild cold-like symptoms for some people, but the fact is it's highly transmissible.
So, Doctor, there might be some confusion now about accessibility due to the changes in the CDC's recommendations. Can I just walk up to a pharmacy now and get a COVID shot?
So it varies based on your state, and part of it is because of the initial FDA approval saying only those for all adults greater than 65 and people 6 months to 64 that are at high risk for severe COVID. And that's when we go into that really, really long list for chronic conditions. And so pharmacies want to make sure that the cost for the vaccine is going to be covered by insurance, or to make sure that people have gone through and been assessed for that risk factor, because they don't know if someone walks in and wants to get it and they say, yep, I want the shot, and they just have to kind of take people at their word, which I feel they should. And I know many insurance companies in Utah, especially if they're practicing in Utah, they're insurance people in Utah, they are covering COVID, even if you are not someone particularly with the high risk factor. But the thing is, you being able to walk in, pharmacies are gatekeeping right now in a little over 24 states because they want to make sure that someone has at least had that discussion to state you are someone with that risk factor. Now, mind you, their doctor may not think they have it, but if they have a prescription in hand, their provider gives them a prescription to say, yes, you can get COVID. To them, to the pharmacy, you have passed that qualifying risk factor. You've been evaluated for that risk factor.
And then what is the availability? Is there still research, and is the current shot going to be effective or more effective? And then what's the availability of it?
Availability right now, I think it's just started arriving the end of last week. So COVID-19 vaccination for the, mind you, we're still looking at the little children of the Omicron, if everybody remembers that. So this is the J1.1, lineage or variant. But yes, Pfizer still has their vaccine, Moderna, and Novavax. So those are the three that are available right now for the current dominant variant that's circulating this year. It's expected to be 30 to 50% effective for reducing the risk of hospitalization or severe COVID.
Has there been any sign of side effects? Or, I mean, I know there's always someone who reacts from different things, but overall, is this safe?
Yes, it is safe. It's not much different than the side effects that people were incurring when the mRNA vaccine was starting to be provided to folks in early 2021. So it still hasn't changed. There's still that small risk for, I think, 1 in 100,000 to young males that they can develop a small chance of pericarditis that can occur. You have some people that will have prolonged body aches, maybe a low-grade fever for 1 or 2 days. I would have to say that probably happens in about 20% of folks, but most of the time, most people just have some soreness in their arm for a day or two, and then they're fine.
Overall, do you recommend the vaccine?
Yes, I'm getting it, but I'm also a different part of the population because I'm going to be exposed to those that are high risk because I work in an emergency room. So I would want to make sure that I'm protecting my patients.
Dr. Richard Ferguson is an emergency room doctor and president of the Black Physicians of Utah.